I'm the founder of the Total Health Center. I've been practicing here in Virginia Beach since 1996. And tonight we're going to talk about thyroid problems. All right, now, I'm a chiropractic physician. And some of you may be wondering, what does chiropractic have to do with thyroid? Well, I can tell you right now, we're going to talk a lot more about the thyroid than just chiropractic philosophy. I became a chiropractor because I knew that there had to be more to health than just drugs and surgery. And so that's kind of what led me to the profession, is more about natural health and being wellness and being healthy versus treating sickness and disease. So I'm not your average chiropractor, and I'm definitely not your average doctor. I have specialized training in functional medicine. We're going to talk a lot about that tonight. I've studied some of the top functional medicine practitioners in the country. Dr. Michael L. Johnson, who wrote the book, What to Do When the Medications Don't Work. And this guy, Dr. Baptiste Karazian, he wrote the book, Why Do I Still Have Thyroid Symptoms When All My Lab Tests Are Normal? Now, has anybody here heard of this book or read this book? Just raise your hands. So one, okay. Now, if we were on the East Coast, there'd be a lot more hands being raised. So we're a little bit behind the times over here on the East Coast. So tonight, this is cutting-edge information on functional medicine, in particular on the thyroid. So tonight, we're going to show you how to get a copy. You actually get a free copy of this book by the end of the talk. So this information is cutting edge in the latest thyroid treatment. By the end of this talk, you're going to understand what makes functional medicine different from what you're currently getting from your doctor or your traditional healthcare model. You'll understand why you've not gotten results that you want and that you're looking for. And you'll understand what you need to do to get those results. All right, so at this point, I want to kind of get a little idea about everybody that's here tonight and find a little bit about why they're here. So I'm going to kind of introduce myself. Loretta, you're actually a patient of ours. It's great to meet you. Now, what brings you here tonight?
I was curious because I've had thyroid problems about 6 years ago when I had hyperthyroidism and had to get treated.
Yes.
And I still have some symptoms.
Well, this is going to answer a lot of those questions. I'm glad you were able to make it tonight. So it's nice to see you make it here. Cindy, I'm Dr. Scott. Nice to meet you. So what brings you here tonight?
I was diagnosed with hypothyroidism about 4 months ago, and I also had last year surgery to remove a bad thyroid gland twice because the first surgeon messed up.
Aha. So again, this will kind of clear up some of that information.
I'm looking forward to it.
All right, it was a pleasure meeting you. Thanks for coming out.
Nice to meet
Okay.
you.
That's okay. Edie? What brings you?
I had an ultrasound, and I had an ultrasound for something else. I had 2 bad vertebrae on my neck,
Okay.
and it shows that I have 2 nodules, and I have a lot of the symptoms of thyroid.
Yeah, and as we'll talk in the talk tonight, a lot of thyroid conditions go undiagnosed. People don't even know they're having them. So glad you could make it tonight.
Thank you.
All right. Anita? All right. Now, are you here as support?
Yes.
Okay, I got that. So what brings you here tonight?
Well, I have thyroid problems. I've had it since I was about 40.
Okay.
And the first doctor did a biopsy and it was no cancer cells. So I noticed it was getting large. I went to another doctor and he said that there's one on this side that is deep.
Yep.
And they probably won't be able to need a biopsy.
So you have some nodules on that. And you're also you've been diagnosed with hyper or hypo or either one?
I think it was, so we're trying to decide what to do now.
Have you been on any medications or anything at this point?
Yeah, for quite a while.
All right. Well, thanks for coming out tonight. It was nice to meet you.
Thank you.
All right.
Kristen
Carter.
Kind of similar situation.
Okay.
Been on Levoxyl forever.
Yeah.
I've had a history of asthma on and off prednisone. Just cannot fight that. It just contributed to the weight gain, and no matter what I do, I just can't get back to where I was.
Exactly.
It's tough, and I keep clearing my throat because I'm
Feel fullness.
coming down off the prednisone now, the amoxicillin, but I still have that congestion from the asthma in my chest, and I'm just, yeah, fighting it.
Well, this will be good, again, good talk for you. Yeah, because we're going to really explain, about how your thyroid affects everything and how this is really about your body and your health.
I'm very interested in chiropractic. I suffer from migraines really badly also.
Okay.
And that there's probably some talk there.
Yeah, we're not going to talk too much about specific chiropractic treatment tonight, but let's talk about that later. Yeah, we can always talk about that. This is really a very separate subspecialty called functional medicine, and there's everybody from chiropractors to naturopaths to medical doctors who practice this particular form of medicine. But it's more of a natural approach, so people that are geared towards natural medicine, like chiropractors and naturopaths, tend to be the bulk of the practitioners. So, and Mrs. Slicer, what brings you here tonight?
I don't know. I have hypothyroidism. I am on the similar medication. I was on travel school also for 8 years being blind and also deaf. And I don't know if blindness was related to hypothyroidism or this was something else. No, I was on the similar medication and approach.
Again, once you have to go through the talk tonight, you'll maybe clear some of that up about how, what can cause these conditions.
It's like,
Yeah, well you can, and you don't even have to write down, as long as you know what your symptoms are. I'm going to talk about that later, and I'm just going to say each section, and you tell me if you've got stuff. No, not experience.
Because I am taking medication.
Gotcha.
Means I want rid of the medication in my life.
Exactly.
This is medical.
Awesome. Well, pleasure to meet you. Thanks for coming out tonight. All right. Lois?
Yes,
Dr. Scott, nice to see you.
nice to meet you.
What brings you out here?
To learn all I can about a natural supplement, whatever can help me. I was diagnosed in 1985 with hypothyroidism. I've been on medication since that time. That has not worked.
Right.
And so we'll see what you all.
That's what we're talking about. Yep, well, I'm glad you can make it out tonight. All right. Judy, Dr. Scott, nice to see you. That's what brings you out here.
I just have been hypothyroidic since 2003, 2004, and I just thought maybe there'd be more information because they take THS4 and
That's right.
THS3, and
Yeah, this is going to go way beyond that, so this is being very educational. Yeah, so anybody that's had traditional thyroid treatment, this is great stuff. All right. Dr. Scott, nice to see you. So what brings you out here tonight?
Well, I have been going to the doctors for years, getting tested for thyroid problems because every week I have the same symptoms that I have. And my tests always come back normal. And
Right, so you
so
got all
they
the symptoms, but the blood tests are normal.
are normal. So I'm trying to figure out what test I can tell my doctor when I go see him so that he can test me because I think for years I've had a problem with my thyroid.
We're going to clear a lot of that up for you.
Okay.
Help you understand why it is that your doctor does what he does, and they've been treating you that way, and why they're doing that, and what tests that need to be ordered, and how to get those tests done. Really?
Nice to meet you, Dr. Scott. I'm trying to learn all I can learn. I don't have thyroid symptoms that I know. I have other medical things. I think anything I learn, and also support from my friend.
Wonderful. Thanks for being here tonight. And the topic that we're going to be discussing is thyroid, but as you'll learn very quickly, functional medicine really encompasses all areas of health and a lot of chronic conditions. And so if you have other health conditions, you're going to learn something tonight. So this will be a great opportunity. Thanks for coming out. All right, so a little bit about some U.S. health statistics. So when I say 1 and 2, if you look around the room, that'll be half of everybody in the room. So just kind of put that in perspective. 1 and 2 will die from some type of heart disease. 1 and 2 will develop some form of cancer. 1 and 3 will develop diabetes. 1 in 3 women are clinically depressed. 1 in 6 couples are infertile. 1 in 6 kids have some type of neurological condition. 1 in 8 have an autoimmune condition. And 1 in 8 women have a thyroid problem. So these are all chronic diseases. So in some ways, we've never been sicker. So here's another question for some of you. We'll just kind of do a little raise of hands. How many people here fall asleep at 10 and wake up feeling fresh? Okay, I'll raise my hand for myself. Okay. How many people here weigh what they did when they were 21? Okay. How about, how many people here have the same energy at 4 in the afternoon as they did at 9 a.m.?
Are you gonna raise your hand?
I do. I'll be the only one here. Okay? How many people have burping, belching? You can raise your hand, Tim. Burping, belching, tongue tied.
I'm also saying, see if they're wearing wedding rings if they're married.
Belching, bloating, and indigestion following your meals. And this one you can raise your hand if you have it. So I'm not raising my hand on this one. So if you feel like, okay, sometimes some indigestion after meals. Okay. How about 2 solid bowel movements per day? Okay, all right. Some of us don't have that. All right. So the World Health Organization, they've studied all the world's health around the country, and they've studied over the top industrialized countries, and they found that the U.S. ranked #1 in terms of crisis care. So we have the best medical emergency care in the country. So we're doing some things right. But the bad news is that in 1997, we ranked 34th in the world as far as overall health care. By 2000, we ranked number 37, so we're going the wrong direction. By 2007, we ranked number 48. 2009, we were 50th. So we aren't getting better at what we're doing, we're actually getting worse. We've spent more on healthcare than any other nation, but yet we don't have the #1 health in this country. Why aren't we #1? That's the big question. So this is why I do what I do. This is why we have plenty of disease treatment physicians and crisis care physicians in this country, but we don't have anybody really doing what I'm doing, except for myself and about 500 doctors around the country. Like I mentioned, this functional medicine is really about taking care of these chronic conditions and getting ourselves healthy. So I've spent my life studying health, and I'm frustrated with the one-sided system that we have in our healthcare system. So people are suffering, like yourselves, for years, since '89 or whatever we had, a couple of those, and they don't even know that there's a better option out there. So I want to change that, and that's why we're here tonight. All right, so a plant. Whenever you see a sick plant, some of the first things they think of is, well, probably needs water, right? Or, maybe some air, or some sunlight, or it's not getting enough nutrients. It's all common sense stuff. Maybe it's got some kind of toxin in the soil. But how about when you see a wilting human, right? I bet some of the first things we're thinking of is, what condition do they have? Or what medication are they on? Right? So why do we think like that? Well, there's been a lot of money spent by the pharmaceutical industry to kind of help us think that that's how we look at our health, right? So if you got a bad thyroid, that means thyroid medication for life. All right, so let's do a little raise of hands here again. How many people here take prescription or non-prescription medication weekly? Take 1 or 2 medications on a weekly basis? Just raise your hands. Okay, so pretty good amount. How many take 3 to 4 medications? Okay, yeah, a couple of you, yeah. Anybody more than 4?
Oh, this is called dinner.
That's why we're here.
Yeah, okay, all right. Now, the next question is taking a lot of meds good?
No.
Okay, so at least we're all in agreement there. What does that say about your overall wellness or your level of health?
We're talking, that's why we're here.
Right. Well, and again, that's why we're here, and but we've all kind of become numb to this because people think that's just the way it is, and you go to your doctor, who's part of your healthcare provider, right? But it's really sick care. That's the thing I make the distinction, that our system is a sick care system. It's not a healthcare system. It's not about getting you healthy. It's about keeping diseases and symptoms in check. So that's a primary distinction. So just because emergency care saves lives, that doesn't translate to all levels of healthcare. And that's what we've done. We've taken shows like ER, and we've put them up on a pedestal. We've given our whole healthcare system. And they're treating everything like a crisis. And that's what we do. All right, now, all chronic conditions have some common things. So again, if you kind of look at this over here, thyroid conditions is the main thing we're talking about tonight, but you've also got diabetes, fibromyalgia, vertigo, sciatica, chronic fatigue syndrome, peripheral neuropathy, rheumatoid arthritis, chronic neck and back pain, irritable bowel syndrome, insomnia, Crohn's disease, celiac disease, polycystic ovary disease and infertility problems, migraine and chronic headaches. We talked about that earlier. ADD, ADHD, and all the different autism spectrum disorders. These are all of the different chronic things, and they all have some things in common. So you look over here, you can see simple things like dehydration and oxygen deficiencies and nutrient deficiencies like vitamin D, which just so happens to come from the sunlight, which most of us think is a bad thing right now. Different toxicities and neurological misfiring and imbalances, blood sugar problems. We're going to talk a little bit more about dysglycemia, different imbalances in cortisol, your hormones, autoimmune attacks, food sensitivities. These are very big. We'll talk about that a little bit more tonight. So all of these things tend to correlate with these types of things. So again, when we're talking about thyroid conditions, we're talking about a lot of other conditions that people have, and thyroid is just one of them. So some of you here may be related to that even right now. So again, there's a reason why your body is not functioning right, and it's not a drug deficiency. I think we all can agree that. All the experts we go to are experts in drug treatments, from Harvard Medical School to the Mayo Clinic. So again, if you want your health back, you need a health specialist. Now, all chronic conditions are a combination of different imbalances, and everybody has a unique combination. So again, this is very important because when you go to your doctor, he's going to run very specific thyroid tests. Now there's a thing in medicine called a standard of care. And that standard of care means that, someone way up top has come up with an algorithm, and that's what you do for these conditions. And this is what blood tests you run, and this is what you do for those blood tests. If they come back positive, this is what you recommend. That's called a standard of care. If you deviate from that standard of care, then you're practicing bad medicine. So standard of care is good medicine. So if you're a doctor and upstanding with your colleagues, you're going to practice good medicine and provide the standard of care. But the interesting thing is that there's over 6 different thyroid patterns. So if everybody gets treated the same way, some people aren't going to respond. So in this case, standard of care is bad medicine. Now, your thyroid gland has, there's receptors for your thyroid hormone in every gland, every organ of your body. So this is very important. You may be having problems with your bone metabolism. So people have problems with osteoporosis and things of that nature. Your immune system, getting colds and flus and things. Brain and nervous system. So everything from nervous disorders to sleeping disorders to depression, insomnia. Endocrine system, again, your adrenal glands, your ovaries, your testes, all these problems could be happening. Gastrointestinal function, your liver and gallbladder, growth in sex hormones, fat burning, insulin and glucose metabolism, cholesterol levels, stomach acids, so digestion and such. All of these things can be related to your thyroid. In our current system, there will be a medication for each single one of these problems. And this is all about your thyroid. So again, getting your thyroid functioning. Now we have what's called thyroid crosstalk. So again, on the similar realm that we were just talking about, your immune system can cause a thyroid problem, but your thyroid problem can cause an immune system problem. So they work back and forth. So the question is your thyroid problem causing this, or is this causing that? So how do you find out? That's the big question, right? Well, that's what we're going to do tonight. We're going to explain to you how you find this out and how you can get to the bottom cause of your thyroid. Because just right now, anybody that's being treated for the thyroid is just being treated based on their simple blood test, a TSH, maybe a TPO, or very few blood tests, and then based on that, they're going to come up with an algorithm to give you medication. And say, I respond to it, and how you respond, and adjust your medication. So the great thing about this approach is that once we start to figure these things out, other health problems get better. Like we mentioned about the person in the back who's got some other, maybe not have a thyroid problem, but she's just looking for information. So the functional medicines, you really help understand your underlying physiology. It's all about function. So I can have 5 people walk into my office with thyroid, and each one can have a different cause and a different treatment. So you can't just treat everybody with thyroid medication. So, now, anybody here, has any of your doctors ever explained this to you? Anybody? Raise your hand.
No.
Yours has? So you've read the book, though, haven't you?
No, I've heard about it.
You've heard about it. Okay, so you understand the crosstalk and how the thyroid affects things. Good. All right, next thing we're looking at here is symptoms. All right, so we'll look at these symptoms. So everybody in the room here, just kind of try to do this quickly. Just kind of raise your hand if any of this has happened to you before. Did anybody here have fatigue? How about weight gain, even on a low-calorie diet? Right. So even if you try to lose weight, it doesn't seem to happen. Morning headaches seem to wear off as the day progresses. How about any depression? Insomnia, trouble sleeping, either trouble getting to sleep or trouble staying asleep, or both. Constipation, problems with constipation. Overly sensitive to hot and cold weather. Poor circulation, numbness in hands and feet. Chronic pain. Just a lot of chronic conditions that don't seem to get rid of, clear up on their own. Catch colds and viral bacterial problems very easily, and your wounds seem to heal very slowly. Require excessive amounts of sleep in order to function properly. Chronic digestive problems. Itchy, dry skin. Dry or brittle hair. How about any problems with the hair falling out easily? And anemia issues, and also, or edema, so a lot of swelling, either in the hands or feet or even around the face, or puffiness in the eyes is also very common. So, some of you were mentioning earlier that you've had your lab test done, and they're normal, but you still have a lot of these symptoms. So the question is, why is that? Anybody else here had their lab test done and found their lab tests are normal? Yeah, so a couple of you. Okay. So we're going to talk about that. Number one is you've got the lab ranges are inaccurate and they vary from lab to lab. So this is something that people don't realize. If you have your lab work done in Philadelphia, then you also go down to Texas and have your lab work done to those different places. There are 2 different ranges that they're going to look at. So they do it based on what's called a bell curve. Now the interesting thing about a bell curve is it's based on the population that frequents that lab, and it also is looking at sick people. So again, the people that are going to these labs are usually sick people. So it's really, and the interesting thing about functional medicine is that we look at what's called functional ranges. So functional values are dealing with what should be healthy, what healthy people should look like. So if you see here, here's your abnormal values in your traditional model. These are your functional ranges. So when you're in this area here, this is where your doctor would say, well, you know, your labs are normal. Because what they're doing is they're looking for pathology. So it's all about a diagnosis. So in medicine, you have to have a diagnosis. Once you have a diagnosis, then you can make a prescription. Until you have a diagnosis, there's not much to do. So in functional medicine, we're going to say you're heading towards a pathological process. So you're getting outside of whatever normal optimal range is, and we need to figure out why and get you back into these normal ranges. Yes? So this is another example of some functional ranges versus traditional ranges. So again, you look at TSH, which is a common marker they're looking at. In your functional ranges, much tighter. So we're looking at some tighter ranges. If you start getting to these ranges here, then we're going to look for a problem and start trying to correct that problem. So it's much more sensitive. All right, so the 6 major patterns that I talked about. You've got what we call it primary hypothyroidism. You've got hypothyroidism secondary to hypopituitary. So again, the pituitary and the thyroid there's an axis there, they communicate. If there's a problem with the pituitary, that can cause a thyroid problem. So again, your TSH may be off, they put on thyroid hormone, but it's really something going on with the pituitary, that needs to be looked at or addressed. And in our current system, that's not happening. Thyroid underconversion, which means that you're producing thyroid hormone, but it's not getting converted to T3. So T4 is what your thyroid produces, and it needs to be converted to T3 in order to be active. So for some reason, it's not converted. So why is that? So instead of just giving you T3, because you're not having enough, we want to find out why is your T4 not converted. But again, traditionally, they'll just give you T3. Thyroid overconversion, which means you're converting too much of your T4 to T3. Or decreased thyroid binding globulin. So the thyroid binding globulin is what takes the thyroid hormone and transports it to different parts of the cells. So if your thyroid binding globulin is off, and again, that's another different problem that will be addressed separately. Thyroid binding globulin elevation. And this is very common with contraceptives and hormone replacement therapy. Again, people are on these different things, and that's what's causing another problem. That's a problem with medications. Sometimes they cause other problems. Thyroid resistance, which is where your body is resistant, the cells are resistant to the hormone. We got to figure out why is that as well. So the question is, which one do you have? And again, the only way to know is get the proper testing. And tonight we're going to talk about why you haven't got the proper testing and what you need to do. So what does the Mayo Clinic recommend? Right? This is probably the most premier medical clinic in our country, right? Now I know this is very hard to see, but to make a long story short, this is an algorithm that they use in order to determine thyroid conditions. And really what this is all about is what drug to give and how much to give. So it's a very basic algorithm based on what your TSH levels are, maybe a couple other things. But again, the question is, if you need, these are the experts in drug care. So if you need drug treatment, this is the place to go. So this is really the pinnacle of drug treatment. But the question is, do they even ask, why you need drug treatment? Or how did you get here? And what can you do to get back to the point before you needed drug treatment? That's not even part of the algorithm. It's not part of the question. Their goal is to find out what drug you have and what drug you need to get you on. And make sure that's managed properly. That's how that works. So again, has any doctor here explained to you why you have a thyroid condition in the first place?
No.
Okay.
I've been
Yes.
told it was due to a low immune deficiency.
Okay. Okay. Now, why do you think you have a low immune deficiency?
I'm so susceptible to anything that comes along.
Yes. And again, we're going to talk about why that is. And it is immune related many times. So, but that's close to the answer. But then why is that? So why do you have an immune problem?
Yeah.
What can you do for that?
I was told I was born with.
Okay, well there you go. So, and that may or may not be true, because there are some genetic factors. We're going to talk about what to do if you have these genetic factors. There are ways to treat them and improve function.
I went to a blood specialist that told me that.
Yeah, okay. Yes?
I mentioned to the doctor I was exposed to rat poisoning and food lyser for the plants
Yes.
excessively and
Yes.
pollution around the antifreeze.
Yes.
Or we have one house, the another house was just elderly gentleman left and it was a lot.
Yeah, there you go.
Pollution, everybody get gnats,
Yes.
40 rats we putting everywhere.
Yes.
2 people dead across the street. I was blind and very sick.
So toxic
Yes.
overload.
Can be.
Yes, totally, and that's what we're going to talk about. That's something that would not be looked at because again, your parameters are very narrow. Just look at your thyroid, TSH, maybe some TSH antibodies or TPO antibodies, and that's about as far as they go. And then even if they do find an autoimmune condition, this treatment's even worse. We'll go to that in a minute. All right, so what we do in our office, we do a complete thyroid test. So we do a lot more testing, but this is just on our thyroid basis. We do a TSH, obviously, this is what most of your doctors do. We're also going to do a total T4, which is looking at the total amount of thyroid that your body is producing. Free thyroxine index, which is the amount of T4 that's available for usage. A free thyroxine, which is affected by prescription medications. And we're looking at T3 uptake, which is how much of the T3 is being taken up by the thyroid binding globulin, which is kind of like your taxi driver that takes it to the different areas of the body. A free thyroxine, which is basically your T3, which is what's active that your body can actually utilize. Reverse T3, so your body will take some of that T3 and create it to something called reverse T3, which then can't be converted back to T3. TPO, TPG antibodies, so again, this is where you may have an autoimmune condition going on. And some of you may have been diagnosed with either something called Hashimoto's or Graves' disease. That'll help explain that. So again, we're going to do a very thorough thyroid test, and that's the first step, is to really get that understood. Yes?
If Graves' disease can be in the family?
Yes, so a lot of the autoimmune conditions can be in the family. So if you have certain genetic traits, and very common to be a sensitivity to certain foods, so very common is gluten. So if you have a gluten sensitivity, that can run in families if you have the gene for that trait, and that can cause antibodies to attack certain parts of your immune system. So if they're attacking the TSH, then that's called Graves'. If it's attacking the thyroid binding globulin in those areas, then you feel like Hashimoto's. So we'll get into that in a second.
Okay, thank you.
Now, the missing pieces of the puzzle. So again, if you have TSH test, maybe a free T4 or TPO, that's your Mayo Clinic standards. You're missing big pieces of the puzzle. There's no way you're going to really put those pieces together without all the pieces. You're not going to figure out how to solve the problem. But again, that's not the goal with our standard treatment, is not to figure these things out. The goal is to figure out which medication to give and how much to give. So again, your treatment must be based on limited information. Like it says it's on. It was me. There's nothing wrong with the computer. It was all this computer up here. All right, I think we got it right. Okay, we're back. All right. Anyway, I may have missed a slide.
There's one that popped up.
Yeah. All right, so okay, so 90% of thyroid problems are actually autoimmune disorders. So again, this is where people have all kinds of other symptoms, and they're taking the medication, and it just doesn't seem to be working, because there's actually an autoimmune condition going on. And as I was mentioning earlier, Hashimoto's and Graves' disease are very common terms. Your immune system is mistakenly attacking your thyroid. So again, TPO and thyroid binding globulin, thyroid peroxidase and thyroid binding globulin, that's called Hashimoto's. If it's attacking your thyroid stimulating hormone, then that's called Graves'. And in Graves' disease, you have a hyperthyroid. And some people have hyperthyroid, and then after a while they end up with hypo, or they've gone through different stages. But again, anybody know what they do if you have Graves' disease?
You know, we did an atomic pill.
Yeah.
Kills the thyroid.
Yeah, they kill your thyroid. And the reason they do that, and it sounds very scientific and logical, is because if you have too much stimulating hormone, then that can cause your heart to race, which can cause heart problems, heart attack, kill you. So in order to solve that problem, they make sure your thyroid doesn't produce any more hormone, and then they just give you hormone, supplemental for the rest of your life, and that solves the problem. But the question is, why do you have this? And you have an autoimmune condition going on. Let's figure that out instead of just killing the symptom. So again, the symptom is racing thyroid. So the solution is to take the thyroid out or kill the thyroid. But you need the proper testing in order to figure this out. So. Alright, so again, when you have an autoimmune problem, your autoimmune situation can also cause problems in your pancreas, which is called diabetes. If the immune system is attacking the myelin in your nerves, that's called multiple sclerosis. If the immune system is attacking the cells in your intestine, we call that Crohn's disease. And if you have rheumatoid arthritis, that's when the immune system is attacking the joints in your body. Or you can have endometriosis, when the immune system attacks the uterus. Or problems with anemia and internal bleeding from the immune system attacking your stomach lining. Or ankylosing spondylitis, when it starts to attack your spine. So if you had Graves' disease and you have an autoimmune condition, they kill your thyroid, you're not healthy, are you? You could be setting yourself up for all of these different conditions down the road. So again, our bodies are amazing, and we can survive with these autoimmune conditions for a long time. And actually, a lot of people didn't develop their thyroid problem until maybe in their 40s or a little bit later,
70s.
or even in their 70s. That's right. But they've actually had, if they have some of these food sensitivities, or like I said, like a gluten problem, they've had that their whole life. But their body was able to, their immune system was able to keep it in check until it finally gets overwhelmed, and then you start to develop symptoms. So our bodies are amazing, and even with all four cylinders aren't firing, we still keep chugging along down the road. So we got, why is the body doing this? What causes these autoimmune problems? And we have two main categories called dysregulation and an active antigen. So your dysregulation is things like chronic inflammation, blood sugar imbalances, weak adrenal glands, hormone imbalances, and different neurological imbalances. All these things are dysregulations in your system that can start to wreak havoc and cause autoimmune conditions. You also have what's called an active antigen. This is any type of chronic infection. So some people have like an Epstein-Barr virus. It's been in them for years, and they just kind of fight it off and kind of ebb and flow with just feeling bad. And that can be undetected for many years. Same thing with parasites. So we don't think of parasites as being really part of American society, but many people have undiagnosed parasites affecting their immune system. So
Doctors, they deny.
That's right. That's right. So again, and we're not here to just go totally, bashing that system completely, because, like I said, they do a lot of great things. But unfortunately, this type of information doesn't really go well with prescribing medications. And unfortunately, that's kind of that's where all their education comes from, and that's where their information is coming from. So they're doing what's the latest thing, what they're being told. Standard of medicine is don't worry about it. Don't even test for this. Or the blood test they use is only looking for just some very, unique things and not all things. Again, gluten sensitivity and soy sensitivity, not really looked at at all. Environmental toxins, like you were mentioning, so being exposed to different toxins. And undigested food, which is what we call leaky gut situations. So you can have this and really not even know that it's going on. You may not have gastrointestinal disturbances at all, but you have this situation, which is, again, challenging your immune system. And again, the only way to know is to get the proper testing. So again, current standard treatment for thyroid conditions is Thyroid. So the question is, why is this not working for everybody? If it worked for everybody, then we wouldn't have this class tonight, and we wouldn't have these people in this room. This is based on a 50-year-old model. That's what the Mayo Clinic is working on. So again, what we're talking about tonight is cutting edge. So Dr. Karazian's book has over 2,000 references. I mean, this is latest research coming out, and he put this stuff together and created this book. All right, so are we frustrated yet? Right? So this is why we're here tonight, right? Everybody?
Yes.
Right? Because we're frustrated and we're not getting the results that we want. So again, how can your doctor help you without ordering the necessary tests? And again, in their defense, their hands are tied because they're overworked, they're working for HMOs, and they don't have the time to do the detective work. And like I said, it's not part of the standard of care. So your insurance is not going to authorize what you need. So if you try to run some of these tests, they're going to say, why would you run those tests for a thyroid problem? That's not what you do. So they're not going to pay for that. Because the insurance companies are always trying to cut bills and keep costs down. So any unnecessary tests will be authorized. So they're kind of stuck in a rock and a hard place. All their continuing education is sponsored by drug companies or insurance companies. So if we can find a way to get you off drugs, who's going to sponsor that? That's their worst nightmare. Because they got lifetime patients, Thyroid, right? And the standard of care is to kill their thyroid, so they don't even have a choice, even if they do come across someone like me. So, we can help you if you've got an autoimmune condition and you already had your thyroid destroyed. You still need to get your autoimmune condition under control, but you're still going to need to be on thyroid. So I'm not saying that everybody can be off their medication. And sometimes you need it. And again, not having the medication is worse than not having an underlying condition treated. So if you're not getting the underlying condition treated, you need to be on thyroid medication because, like I said, it communicates to every cell in your body. So you've got to have that. So not by any means saying everybody just go home and get off your medication. You don't get off it unless you understand how and you're able to get your physiology functioning to the point where you can actually do it. So, again, we look for the cause of your problem. So, we don't cover up your symptoms and hope for them to go away, but proper testing is necessary. So when you find the cause, you have the solution. So some of the other specialized testing we did, we talked a little bit earlier about some of the specialized thyroid testing we do. This is some of the other testing we're looking at. So again, this is something that would not be normally looked at for a thyroid problem. You're doing, obviously we do a complete thyroid panel, which again, even for thyroid problems isn't usually looked at. We look at the thyroid antibodies to see if you are producing any of these antibodies towards your thyroid. Vitamin D levels and anemia. These things are very common. They're starting to catch on to vitamin D a little bit. So yeah, they're a little bit, but again, they're still kind of behind the 8 ball a little bit, and even the levels are recommending are not quite what they need to be. And everybody's different. You got to keep testing because some people, especially with autoimmune conditions, need more vitamin D than the average. Again, immune panels. So we're going to look if there's some type of immune system going on. We have 2 main systems called your Th1 and your Th2 T helper cell. We're going to look at that. We're going to look at your adrenal stress. This is a great test right here. It's a salivary test. So we're going to look at saliva and not blood. And we're going to track that through your cycle of your circadian rhythm. And it's going to look at your DHA, your cortisol levels, progesterone, and certain immune complexes called secretory IgA or SIGA. So again, that's a very important test, and a lot of people have problems with this and have no idea it's even happening. Food sensitivity. So again, you have gluten, soy, yeast, dairy, eggs. And the sensitivity is different than allergy. So many people say, well, I've been tested, or I had the allergy prick test, or I'm fine, I had these tests, but you've not had these tests done from a functional perspective, and most you've not had it done for sensitivity, versus, again, they're looking for something that's like blaring. as opposed to sensitivity. So you can have a sensitivity, and you can eat an egg and don't know anything. But in your immune system, it's ramping it up every time you eat it, and you don't even know it's happening. Microbial ecology profile. So again, this is looking at your stool sample and looking for gut infections, parasites, yeast, malabsorption, leaky gut. So very, very, very important to figure these things out. And that's what separates us from your traditional testing. So again, these are some of the treatments that we use. Modulate the immune system, so figure out what's the trigger in your immune system, then help you figure that out and modulate that. These are advanced protocols, again, the cutting edge of functional medicine, and nobody's doing this, except myself and about 500 doctors around the country. So again, proper testing is crucial to get this stuff understood. So putting it all together. You're not going to put it all together unless you do the proper testing. And at this point, does anybody feel that they've had all of this testing completed for their particular problem? Right? Yeah, I wouldn't think so. And even if you did think you had all the tests, you said, my doctor ran all the tests. Again, they were looking at it from a pathological perspective versus a functional perspective. And again, even the testing that we're looking at is looking at functional testing. So some of the stool samples or the saliva samples, they wouldn't use that. They would use more a serum or blood test instead, which is not as sensitive for certain things. So the pieces of the puzzle. Most of the people that come to me don't have all the pieces. So they kind of look like this, they're all scattered, and what are your chances of putting the pieces together without all the pieces? Not very good. So once you get all the pieces, then the puzzle can actually start to fit. And we start to figure this thing out a little bit. So real healthcare is about improved function, not just treating your symptom. Because again, you can have your thyroid low, get a little TSH, it comes up, it's in the normal range, and still feel horrible. And you've got constipation, so you've got some medication for that. You've got depression, you've got some medication for that. And you've got this, so it's a great system. If someone figured this out, that would be a nightmare. Again, not to say that all your doctors are bad, but as part of that system, there's some people that make decisions for them that maybe it would be a good idea. I don't know. So again, the key is to get tested. Find the cause of your problem and correct it. It's that simple. All right, so just think a little bit. If you've been having this problem, where are you going to be in 1 to 3 years? Now you're going to be either worse off, or maybe the same, right? If you continue to do what you've done up to this point, then you're probably going to continue to get the same results. So if you're willing to make a change, then I'm here to help you. So everybody that filled out the metabolic assessment form, you can pull those out right about this point. We'll just hit a couple of these categories to try to speed things up a little bit. Anybody have any 2s or 3s in category 1? Just raise your hand, or you can just even think to yourself, yeah, I had a couple. So that right there is a colon problem. So again, you may have a problem there, and it may not be addressed. It may even be related to your thyroid. So the colon could be causing your thyroid, or the thyroid could be causing your colon. We got to figure that out. How about category number 2? Anybody have a 2 or a 3 in category number 2? Okay. So again, this is digestion or stomach problems. So if you're not digesting properly, then you're not absorbing the right minerals. You're not absorbing the right vitamins. You may not be getting enough protein breakdown. And then that food in your stomach is going to go into your small intestine when it's not ready, which is going to cause an intestinal problem. Let's see, how about, we'll skip over to 6, category number 6. Anybody have anything going on there? Any 2s or 3s? Okay. So that category is called blood sugar. So again, you're having problems with regulating your blood sugar. Now, you may not have been diagnosed as being diabetic, or you may not have been diagnosed as even hypo or glycemic or insulin resistant, may have had no diagnosis. But again, in a functional perspective, this could be part of the big picture. All right, so I think we all get the point on some of those. So the question is, how are you going to find this out? How are you going to find out what these categories mean and how they're related to your problem? Is your doctor going to do it? Anybody here think your doctor's going to be able to do that for you?
No.
How about the Mayo Clinic, right? If you go to the Mayo Clinic, you think they're going to be able to do that for you?
Yes,
You think they will?
you go up there to Mayo Clinic.
You think they'll do the test that I'm talking about? They'll be able to tell you what
If you ask them for those specific tests.
Okay. I have patients who try that with their doctors. So it's really about whether, again, they have some standards of treatment, and then they also are the experts.
Yeah.
So when a patient goes to them and says, I need you to run, this saliva test.
Yeah. Well, they got.
They're not necessarily going to take kindly to that, because they're like, you're telling me, the thyroid expert, that I need to run a saliva test, and we've already run
Usually
your
what they do.
thyroid binding globulin, so where are you coming from?
Well, I think that you've got to have a little bit of health history to take with you there. They've got to know that in order to do these tests.
Well, let me ask you this. They have your doctors have your health history.
Yes,
This is the
they
thing about it. Your doctors, whoever you're treating, I'm not trying to bash any of these doctors. They're good people, but what I'm trying to get people to understand is that this is not going to, people think that they can go to their doctor and get this stuff done. Your doctor already knows your information. He knows your history. Maybe he doesn't. Maybe he should. So again, we're looking at doing some detective work and figuring this out. But why hasn't he done it already? I mean, why hasn't he ordered that saliva test already?
I'm going to ask him when I go next week.
You do that.
To my endocrinologist.
Go to your endocrinologist. Go to your, whoever you want to go to.
He's one looks like a
And they'll have an answer. And it'll probably sound pretty good. But again, if that's working for you, then stick with it. That's why we're here tonight. Because if that's working for you, then really, that's not, this is information. It's maybe help spur some things, but, that's what we're looking at. So, all right, so what we do is called a case review. This is how we start the process of figuring this stuff out. This is really what makes us different. Because like I said, nowadays you go to your clinic doctor's office and he starts writing a prescription before you can sit down. Right? And again, in their defense, they're under pressure from the HMOs, they got to see volume, and when I was at one of the seminars, Dr. Tatis was actually teaching this seminar, he had one of the professors at one of the universities. There was another medical conference right next to him, and he just happened to come into his lecture. And after the lecture, the guy was like, "Wow, this is amazing stuff." So he went and had lunch together, and they started talking, about the possibility of getting his students to understand what he's teaching about thyroid. And his comment was that most of the doctors that I teach would laugh at me if I told them that they needed to take a 2-day seminar on thyroid. They would say, "What do you need to do for 2 days? TSH, thyroid binding globulin, Thyroid. Why do I need 2 days for that?" That's their attitude. So again, that's where we're coming from. So again, what I'm going to do is do a full consultation. So we're going to get some history. We're going to do an exam. Any blood work that you have, you bring it in. So like I said, if you think your doctor's done some very good testing, that's great. Bring that in, and that can be helpful to me. I'm going to look at that. Then if I determine that we need some more blood testing for me to really get a little bit of understanding, we may recommend that on that day. Then we'll come back on another visit, and we'll kind of review, at that point after we do the consultation, I may recommend some more questionnaires, maybe something similar to this, maybe something else. So when we bring that back in, I'll review those with you. We'll take a look at that. And at that point, I'll be able to tell you if you're a candidate for care. Now, everybody that comes to my office is not a candidate. Like I said, there's a lot of different reasons you can have a problem, and there's a lot of things I'm looking at to determine if I see a clear clinical path towards helping you. So the beautiful thing about what I do is that we get great results, because I only pick people that I can help, so it makes practicing fun. So we get some really great results. If I don't see a clear path, then I'll let you know that right up front. So we'll be able to tell you that, and like I said, if we accept you as a patient, then there's a good chance you're going to get better. Now we do have some ground rules. So some of the ground rules are no smokers. Now that may be kind of self-evident, but the truth of the matter is that, number one, we're talking about health. So, we're trying to get you healthy, and that just runs counter to what we're trying to do. Not only that, smoking depletes the body of oxygen and nutrients, so again, that's just going to go counter to what we're trying to do. So you've got to already be on the path towards either quit smoking already or willing to quit before we can get things going. And you must be able to make lifestyle change. So again, some of the solutions that we come up with may require some lifestyle changes. So it's a lot easier when you go to the doctor and he says, okay, all you have to do is take this medication every morning. It's not that much of a lifestyle change. But if we find out that you've got a gluten problem, your lifestyle is going to change. So gluten is in everything. And that's a whole other lecture we could talk about gluten. But it's not just as easy as just not eating bread. There's a lot more to it. You've got to really change your diet. So that's not fun. But you've got to be willing to do that. Because that's what it takes. You have to be personally responsible. Take some personal responsibility for your health. And be able to do what it takes to get yourself healthy. And you must be willing to pay for the program. So again, that's something that we need to talk about because we've all been conditioned to expect our insurance to take care of our healthcare needs. And as I mentioned earlier, the healthcare model is not working. And there's a reason for that. So again, that's why we're here tonight. So, some things may be covered, some things may not, but I just tell people right off the bat, I'm not trying to mislead you into thinking that you're going to have all this covered. There's a good chance a lot of stuff won't be covered. So again, traditional healthcare model, insurance model is great for crisis care. You fall off your bike, you get hit by a car, that stuff works great. Where you get to a life-threatening, heart attack, they're going to take care of you. But again, I like to prevent the heart attack, or I like to prevent the thyroid problem from getting to the point where you have your thyroid destroyed. So if you want quality health care, you're going to have to dig into your pockets. And why not? We do it for everything else. You want a cell phone, we all got fancy cell phones with big cell phone plans. We got flat screen TVs with cable and HBO and all this stuff. You go out and buy a nice car, right? People have cars and they drive around in and vacations, right? So people do that and they think that's normal. But yet pay for your health care, some of us think, oh, well, blah, blah. So, you have to think about that. How many years do you have left? How many years have you been suffering with this? You want to spend the rest of your time tired, not being able to sleep, depressed? I mean, seriously, you really want to go that way? Because it doesn't have to be that way. So you need to wake up and realize that the insurance-driven model is not necessarily working for you. Again, if I accept you as a patient, then you can have a new life in 6 to 12 months. So again, it's going to take a little work, some time, but you can change your life around. Now, one of the things we're doing is, tonight, we're going to allow you to come into the office and that full 2-visit workup. It's normally $225. We're going to do that for $125. And that's going to include the 2 visits, anything we need to do to figure out what's going on with you. If you sign up tonight, you get a copy of the book. And again, the beginning of the book is pretty user-friendly. It's very, some good information. It really helps you understand a little bit about this type of work. Then it gets a little technical towards the end. So if you just get through the first couple chapters, I think you'll really enjoy that a lot and you'll get a lot of information from it. There's also a DVD that I have that covers a little bit about what we talked about tonight, but a little more detail to help understand some of the specifics of what we're doing. So we're doing a reservation fee tonight for $65. And then when you come to the office, then you just need to pay $60, and that'll be the $125. And then we'll be able to get this thing figured out.
That's for one visit?
That's 2 visits, so that's the 2 visits. So the first day is a consultation, examination, reviewing any of your blood work that you bring with you. So bring any of your records that you had relating to your condition or even unrelated. And I'm going to look at all that. And then if I feel that we need to do some more testing, I'll make that recommendation before your next appointment. So by the time I see you at the next appointment, I'll be able to go over some of those things with you and tell you what I think is going on, more specifically about what's going on with you, and be able to tell you, A, if I can accept you as a patient, and what to expect in terms of what tests you may need, what may or may not be covered by your insurance, and give you an idea what to expect cost-wise. So I'll answer all those questions for you. All right. Now, I usually like to end with a little bit of a story. You may have heard this one before. There was a man who was caught in a flood. And as the water started to rise, he started to get a little concerned. Because the water was starting to flood into his home, and his floors were starting to ruin. So he was really getting upset with his possessions. As the water continued to rise, it started to damage his walls and his furniture. So at this point, he's really at his wit's end. But the water continues to rise, and at that point, he starts to realize his thoughts kind of leave his possessions, and he starts thinking about his health, thinking this could be dangerous. So he starts to pray. He says, Lord, please, save me. I have faith, and I know that you'll do what needs to be done to help me. So as the water continues to rise, he ends up on his roof. And the water is starting to rise very rapidly, and a big, huge log comes floating by. Now, he could have jumped on the log, but he said to himself, I have faith, the Lord is going to save me. Well, the water continues to rise. He's got up to his knees now, and a rescue raft comes by. And they got one spot left. They say, we got one spot left, jump in. He says, nope, save that spot for someone else. The Lord is going to save you. Well, now the water's up at his waist, and he's getting a hard time holding on. He's got his hand around the chimney, and a helicopter comes by. And they say, we can roll down a ladder and save you. He says, no, go get someone else. I have faith, the Lord's going to save me. Well, as he starts to drown, he starts to see a light. And in the light, he sees the Lord. He says, Lord, why did you not save me? And the Lord replies, I tried with all my might, but you ignored all that I gave you. I sent you a log. I sent you a raft. I even sent you a helicopter. So, I can throw you a lifeline, but you got to grab hold. Thank you. So if anybody's interested, Tim here can answer any questions you may have about signing up or any information. Yes?